CARPHA, the Caribbean Public Health Agency, is a CARICOM institution leading the Caribbean's public health response to the COVID-19 pandemic. CARPHA began operations in 2013 and serves 26 member states across the Caribbean region. As the first line of defense between the Caribbean and COVID-19, CARPHA stands proudly in the front lines because our passion is your health and well-being, and our vision is to have healthy people, healthy spaces, and a healthy Caribbean. CARPHA was prepared well before the virus was declared a pandemic. And even while the risk of COVID-19 was low for the Caribbean, its incident management team for emergency response was activated to coordinate the regional public health response. From day one, CARPHA has and continues to strategize with regional agencies and governments. Developed regional documents on the safe reopening of borders, public health border policy, repatriation, economic recovery, resuming travel for CARICOM, and guidelines for multiple sectors and groups. Providing reliable and timely COVID-19 updates and situation reports, the agency is known to be a trusted source of information. Home to the reference laboratory for the CARICOM region, CARPHA developed testing protocols and procedures for detecting possible COVID-19 cases. While conducting training in the proper use of personal protective equipment, laboratory testing, and COVID-19 health prevention measures. Procuring supplies such as testing kits, masks, and other equipment added to the regional benefits. With many states resuming travel, CARPHA's novel traveller health program joined forces with the Caribbean Tourism Organization, the Caribbean Hotel and Tourism Association, and other regional tourism agencies to form a COVID-19 tourism task force and developing proactive health measures for healthier, safer tourism. CARPHA's experience in handling public health emergencies cannot be overstated, as the agency successfully led the Caribbean through several other outbreaks. The dedicated CARPHA teams of multidisciplinary experts are always prepared to go beyond the call of duty because we recognize that people's lives are at risk. Dr. Joy St. John.
The incident management team is our think tank for ensuring that we understand the global COVID-19 situation and how it applies to the CARICOM region. We ensure that there is a matching of needs based on science. So it is not just throwing money or items in a particular direction. It's based on the science, again, linked to the chronic disease burden, the age distribution of the society, etc. One of the things that we have been very privileged to do is to have multiple interactions with the heads of government. And so the heads of government have been frequently updated with what is the situation and what are the risks and threats and opportunities.
Without a doubt, CARPHA has helped in showing the world that despite the Caribbean's small size and under-resourced systems, it can overcome unrelenting adversity. Dr. Lisa Inder.
CARPHA as a public health agency has a multi-sectoral approach in terms of focusing on the pandemic. We would have focused on the tourism sector through our tourism and health program. We are looking at how do you address COVID during perhaps in a hurricane or a disaster. We have our chronic disease department, which is looking at our vulnerable populations. We have our entire laboratory department that is not just focusing on the laboratory testing, but things like validation and making sure that we are turning around our information, in a rapid manner. Our turnaround time has been less than 48 hours, sometimes less than 24 hours for countries.
We want to single out the staff of CARPHA, which is located here in Trinidad and Tobago, who provided us with absolutely exquisite professional help and guided the heads of government and other decision makers in the Caribbean, we have been well served.
As we reflect on the events of the last 3 months, were it not for the Pan American Health Organization, PAHO, or CARPHA, the Caribbean Public Health Agency, and more recently the WHO, we would believe that we were living in the wild, wild west that we see in movies, where only those who are strong and well endowed should survive.
The CARPHA staff assures you that we remain resolute in the fight against COVID-19 and we are determined to fulfill our mandate to prevent disease, promote and protect the health of all Caribbean people, even beyond this pandemic.